NA Groups and Medication, Part 1. As outlined in times of illness, the choice to take prescribed medication is a personal decision between a member, his or her sponsor, physician, and a higher power. It is a decision many members struggle through. It is not an issue for groups to enforce. This pamphlet is not intended to speak to members about the personal decision of whether or not to take medication, nor is it trying to convince members to have different opinions about the use of medication. What this pamphlet does address is that groups are often better able to carry the NA message and welcome anyone to a meeting when members come together to discuss this issue. Each group is autonomous, and this pamphlet is simply meant to provide groups with a tool for how to have their own discussions. In these discussions, we must remember that regardless of our personal opinions, decisions, and experiences, our 12 traditions remind us that the use of medication is an outside issue for NA groups and that all addicts are welcome in NA. The information here is intended for NA groups as they consider how to address this issue. As a part of this discussion, drug replacement is addressed in a separate section because NA's philosophy of complete abstinence differentiates a drug used as a replacement from prescribed medication for other mental or physical conditions. We hope the following approaches will help groups in their efforts to preserve unity, welcome members, and create an atmosphere of recovery. Our common welfare should come first. Personal recovery depends on NA unity. Tradition 1. When NA groups consider the topic of medication, including the use of prescribed medication for surgery, injury, illness, and medication for mental health, we can begin by acknowledging the complexity of the situation. Those who take medication tend to feel judged and treated as if they don't belong in NA, while others believe a member's decision to share while taking medication compromises a meeting's atmosphere of recovery. Some members have seen friends who've taken medication relapse, and some have seen friends who've taken medication stabilize and stay clean. In spite of the strong feelings and opinions we may have about the issue of medication, groups must stay focused on how they can welcome members and carry the NA message of recovery.